Okay, my name is Rachel Hazan. I am one of the co-chairs of the SBH Fertility Support Program. Tonight, I'll be sharing my story with my fertility specialist. Is she frozen right now? Dr. Susan Lobel. She's frozen for me right now. Anything? Okay. Okay, I see you again. Dr. Susan Lobel, who is the Director of Metropolitan Reproductive Medicine, and who you will find out shortly, saved my life 7 years ago and gave me the ability to have children in the future. But we'll get to that, and I hope I didn't give away the ending here. All right, Dr. Lobel, do you want to?
Well, first of all, Rachel, thank you very much for the privilege of being your doctor the past 7 years. And it's really been a pleasure getting to know you and Eddie and your families. And also, thank you very much for inviting.
Did you see that too?
I got cut off, but
okay.
So, so thank you very much for inviting me to join you. And for people watching us tonight, I think some people are going to be surprised to know that given that you come from a large family and you were in your early 20s when you started trying to get pregnant, and you don't have any underlying major medical conditions, that that you had difficulty. When did you realize that you and Eddie were going to be amongst the 1 in 6 couples that has difficulty conceiving? And what did you do?
So I got married right before I turned 23. I was probably one of the last of my friends to get married, so I felt like I had to play catch up, so to speak. About a year after we got married, we started trying, and I always had very regular periods, so I felt like this is going to happen right away. I had not a worry in the world. I remember one of my best friends said that she was still trying when I first started trying. I was like, okay, we're gonna like do this together. And I would say by like month 4, I was like, okay, what's going on? After 6 months, I went to my OBGYN and did like a general workup, make sure all the pipes were clear. Maybe you want to explain a little bit of what happens in that general workup.
Okay. Well, basic evaluation, which you were a little bit ahead, that sorry, can you hear me?
Yeah,
okay.
Perfect.
So, so basic evaluation in, well, what the numbers are is that of couples that will conceive on their own, 65% will conceive within 6 months, 85% within a year, and 95% within 2 years. So for women under 35, we generally recommend waiting a year before testing, unless there's the has irregular periods or there's some other hint that there may be a problem. But it also is reasonable after 6 months to do the basic evaluation, which are some blood tests to check hormones, ultrasounds to look at your ovaries, a test called a hysterosalpingogram, which is a radiologic test that where a small amount of dye is put through the uterus, is put through the cervix into the uterus and fills up the uterus and goes out the tubes, so we can visualize that the uterus and tubes are normal, and checking a semen analysis on the husband. So I think that's what you probably had done with.
Did everything and everything checked out. I did have very, very painful periods from day one, I want to say. I got my period when I was 12. Since I was 12, they've been very, very, sometimes debilitatingly painful. I was writing on my Instagram the other day that on September 11th, when everyone was in school, I was home in bed with period pain. That was just something I was almost used to after a couple of years. My mother always said, you're gonna be great. You don't need Lamaze. You've been doing Lamaze your whole life. Sort of like rolling over in the bathroom in pain some months, but we really didn't think there was a connection there, and we just went ahead and continued trying. About the year mark, because that's what I was told. You can't really do much before the year. By the year mark, I was hatched, to say a Syrian term. Really hatched. I remember finally getting the courage to pick up the phone and call a fertility specialist. And the first fertility specialist that I called, I remember the secretary was so nasty on the phone, and she told me, well, we can't see you for another couple of weeks. And I was like, but I'm going to have to wait an extra month. I could have called you a month ago. And I hung up the phone. I was so upset. And at the time, I was reading Time magazine cover to cover every week. And there was this write-up about a doctor, and it sounded very promising. And he had a beautiful fertility center in the city. And I called them, and they said, no problem. We'll see you tomorrow. I was like, oh, I'll see you tomorrow. Tomorrow, it's a good sign. Okay. They did think that there was a possibility that I had endometriosis, which maybe you want to get into now. But we decided to not have a laparoscopy surgery to find out, and we decided to go ahead with assisted reproductive medicine.
So if I can jump in for a few minutes. And so when you had your basic evaluation, it showed that you were having regular periods, ovulating, your tubes were open, your uterus was normal, your husband's sperm was normal. So
Yes.
that leaves two possibilities. What we call unexplained infertility, which a more formal definition is multifactorial subfertility, when there's not one big thing. It's not that your tubes are blocked, but maybe they're a little bit klutzy at picking up the egg. And you take that and combine it with the fact that maybe the sperm swim great in the lab, but they have a little trouble making it up through the uterus into the fallopian tube. Or maybe the shells on your eggs are a little bit hard to fertilize. And each one of these are things that can't show up on our testing, but combined can make it difficult to conceive. The other major possibility is, as you mentioned, endometriosis. And what endometriosis is that the lining of the uterus is called the endometrium. And when a woman gets her period, the uterus contracts and most of the blood comes out through, but in some women, for reasons we don't understand, well, actually, in most women, a little bit goes back through the fallopian tubes inside the pelvis. And in most women, the blood in the little pieces of tissue just dissolve. But in some women, for reasons we're not sure, it probably has something related to immunology, the little pieces of tissue can stick around the uterus and on the ovaries and form little implants. And these implants can cause scar tissue, which can distort the anatomy. And also the implants on the ovaries can produce substances that can have an adverse on the effect on the eggs and make it difficult for them to fertilize. And some women who have endometriosis have a lot of pain. Other women have difficulty conceiving. Other women have difficulty with intercourse. Other women.
I'm wondering if your phone is on battery saver or something.
I don't think so. I think it's poor reception. Are you
Oh.
hear me?
Hmm.
Okay, so so someone with endometriosis can have a lot of endometriosis and have no symptoms. Other women can have just a little and have a lot of symptoms. But just because someone has painful periods doesn't mean they have endometriosis. And the only way to diagnose endometriosis is to do a laparoscopy, which is an outpatient surgical procedure done under general anesthesia, where we make a little cut in the belly button and put in a laparoscope, which is like a telescope, and look inside and can actually look at your uterus, your tubes, your ovaries, and see if there's endometriosis. And if there is, most of the time we can either burn off or excise the endometriosis and remove the scar tissue. Now, 30 years ago, a laparoscopy was part of the standard evaluation for infertility.
Wow.
We don't do it that much these days for two reasons. One is it's invasive. And now that our success rates with in vitro fertilization have gotten so much better than they were 30 years ago, that that even if someone has endometriosis, oftentimes they may want to go to IVF. The other reason is that while many women with difficulty conceiving will have endometriosis, what we've learned, if someone has a little bit of endometriosis, that's not enough to prevent them from getting pregnant. And if they have a lot of endometriosis, they're better off going straight to IVF than doing surgery. So it's only if someone has a moderate amount of endometriosis that the surgery is worthwhile. So the decision to not do the surgery was a reasonable decision. And the
Yep.
alternative for unexplained infertility is to do a combination of medication to stimulate your ovaries and to enhance the hormones related to egg development and development of the lining of the uterus, and to take your husband's sperm and put it directly into your uterus right around the time of ovulation. So that's what you did.
Yeah, so we decided to not do the surgery. We said there's no way for sure to know if I have endo. It was definitely a possibility considering the pain, but like you said, first of all, you could still get pregnant on endo with endo, and second of all, there was no telling for sure. Everything on the scans looked fine. And sometimes endometriosis can show up on a regular sonogram, am I right?
If someone has or endometriosis, a lot of endometriosis, you can see sometimes cysts on the ovary, or you can see that the ovaries are plastered to the back of the, but you didn't have it.
So none of that happened. So we went ahead and said we'll start with IUIs, which is intrauterine insemination. And we did 3 of those. I'm saying 3 like it's like no big deal. It was a very big deal after the first punch. It was very, very taxing. And then we decided to go ahead and start the IVF process.
Okay, so jump in. For those who aren't familiar with IVF, in vitro fertilization. So what you did with insemination was to put the sperm inside the uterus and enhance ovulation. In vitro fertilization takes things one step further, and you take medication to stimulate your ovaries to produce multiple eggs, remove the eggs from the ovary, combine them with sperm in the laboratory to create embryos, and then generally 3 to 5 days after the embryos are created, either put 1 or 2 back inside the uterus or freeze the embryos and put them back at a later time.
Right. So we went ahead and started the process. It was definitely physically difficult. And I also did not tell anybody what I was doing. We did, the first transfer was a fresh transfer, a fresh 3-day transfer. Um, I actually had to stay in Manhattan over Sukkot because, added drama, why not? And my husband had to push me in a wheelchair home because we didn't want to move too much after the transfer, blah, blah, blah. Anyways, there, of course, it's the dreaded 2-week wait. I guess it's around 2 weeks or even a little bit less, until you get the call and find out if your blood work came back positive or negative. So they finally called me and they told me that my pregnancy hormone was very low, and it was likely not going to be a viable pregnancy, but there was a small chance that it would work out. And I certainly held on to that hope, because when they called me a few days later and said the number went down, I was totally, totally devastated. I remember I was in the car with my sister and I broke down hysterically crying, and she was hysterical crying, of course. And I can't explain it. I really just thought the IVF was going to work. I thought it was like the white flag, just like, give me that baby, I'm ready. And it didn't happen like that. But I felt like, okay, the statistics are only going to get better here. Second round, let's go. So we did a frozen transfer, 5-day frozen transfer, and I got the call. Your pregnancy hormone is through the roof amazing. I was obviously ecstatic, cautiously so, because I had never received good news in the past over a year and a half, I guess it was. Flipping out, told my mother-in-law. I mean, like, we were very excited. They even actually told me that the pregnancy hormone was so high it could possibly be twins. And I went into that Shabbat and I was like, I remember looking around the Friday night table and I was like, you guys don't know that I'm pregnant. You don't know I'm pregnant. And I was so excited. And I went back 2 days later to do a follow-up blood work. And that's when the drama again began. My hormone levels were just going like this, up and down. They didn't know what was wrong. There was a lot of different opinions. We were obviously trying to remain hopeful. Everything's fine. Maybe it's not fine. Everything's fine. Maybe it's not fine. The doctor's office had like a million different opinions on what was going on. At one point, they thought it was possibly a vanishing twin. I don't know if you want to explain what that is.
Well, that's when someone starts off with twins, and about 30% of the time, one of the twins doesn't make it, and it can be referred to as a vanishing twin.
Right. So there was all these theories, what's happening. And then I remember that they finally said, this is likely an ectopic pregnancy, but we're not sure. We don't see it anywhere, and hopefully your levels will just go down and your body will figure out what to do on its own. Through all of this, I felt like I was not in the right hands. I never saw the same doctor twice. Nobody could give me a straight answer. I was like, I can't stay here. I need to get a second opinion. And I had heard from my sister's friend and maybe one or two other people that Dr. Susan Lobel will take care of you and you should go see her. And I was like, okay, but I'm like in the middle of I don't know what right now. And anyways, I called you up and you gave me an appointment, fairly quickly, considering that I was a random person possibly going through I don't know what at the time. I came into your office on a Monday, and you want to tell them what you saw then?
So you were already more than a month into your pregnancy. So you had this had been going on for over a month, that they'd been following your levels. And the concern with an ectopic pregnancy, when a pregnancy is outside the uterus, which is usually in the fallopian tube, is that the uterus is designed to stretch, but the fallopian tube is not. And after a certain amount of time, the pregnancy will rupture the tube and cause internal bleeding, which can be fatal. But it can be very hard to tell if you have an ectopic pregnancy, because most of the time the pregnancy isn't a normal pregnancy. So we can't see a nice little sac and embryo. I mean, occasionally we do, but most of the time we can't. So it can be hard to see. And when someone is pregnant, we generally follow the pregnancy hormone levels, which should double about every 2 to 3 days. But sometimes, even with a normal pregnancy, they can rise more slowly. And most of the time, if they're not rising appropriately, it's a bad pregnancy in the uterus, which is what you had the first time, which is called a chemical pregnancy. Pregnancy stops developing before it reaches the point where we can see a sac inside the uterus. And so on the one hand, you don't want to rush to do anything, because most of the time, if it's a chemical pregnancy, it will stop growing and pass on its own. On the other hand, once you start getting about 4 or 5 weeks after conception, there's an increased risk that the tubal pregnancy will rupture. Now, so when you came to my office, I looked, and on ultrasound, I saw a 1.5 centimeter structure that was where an ectopic would be between your uterus and your ovary, but it didn't look like the way a normal ectopic does. And your lining was thin. I didn't see anything inside your uterus. And so we drew a pregnancy hormone level, and which had decreased a little bit from when you were at the other office. So we decided that you would come back in 2 days, and we would see if the structure was still there, and to do a sampling of the lining of your uterus to see if it looked like there was any pregnancy tissue there. And sometimes just removing the tissue, you'll remove the pregnancy, and the level will drop off. So you came back 2 days later, and had let me know that the night before you had experienced some significant, but it had gone away, and and you were feeling okay. And
Uncomfortable. I remember everyone kept saying, "Are you in pain? Are you in pain?" I'm like, uncomfortable.
Okay. So on ultrasound, I saw that same structure, but this time I saw a little fluid inside your uterus. I'm sorry, outside your uterus in the pelvis, which made me concerned that you might be having a little internal bleeding. And I did a sampling of the lining of your uterus, which is not too pleasant, and got very
passed out.
So I was concerned that you had a tubal pregnancy. Now, these days, we try to pick up tubal pregnancies early, and the standard treatment is to give something called methotrexate, which is a chemotherapeutic agent, but we give it in a very low dose, so your hair doesn't fall out. But pregnancy tissue is very sensitive to methotrexate, so it dissolves the pregnancy tissue. So that's standard treatment. But if tubal pregnancy is picked up later on when it's large, or if the ectopic is bleeding or rupturing, then we have to do surgery. So I was concerned that you had an ectopic, but I wasn't sure. So I told you not to have anything to eat or drink, because we may have to go to the OR. But I sent you to an ultrasound unit to get a second opinion. And The doctor there called me and said he saw that what I was talking about, that the structure, he agreed that the structure was in the right place for an ectopic, although it didn't look like an ectopic. But now, instead of having a little bit of fluid in your pelvis, you had a moderate amount, which meant that you were probably having internal bleeding, and which meant that you bought a ticket to the OR. So,
So,
what through your head at that point?
I was by myself in that sonogram room, and everyone talks about that sonogram room. It's a beautiful place, but also a terrible place. I remember that the lady was definitely confused and concerned, and she called in Dr. Saltzman, and he also looked concerned. And he said, "I'm going to go into my office and call the doctor, and we'll talk in a few minutes." He called me into his office, and he had you on the phone already, and you came on the phone, and he told me, "Rachel, it's an ectopic. You are bleeding internally, and we are going to go to the operating room right now, and we have to take care of this." Terror, terror, terror. I was beside myself. I remember so clearly that the doctor pointed to a picture in his office of him and his wife and their two kids, and he told me, "My wife had an ectopic pregnancy, and those are my two children, and you're going to be okay." I think it was the biggest chesed anyone's ever done for me. I was like, okay, I'm going to be able to have children. I don't know if I'm going to survive the day, but if I do, hopefully I'll have the opportunity to be a mother. I called up my husband right away, of course, and my parents, and I told them, "Come meet me in the emergency room. We have an emergency here." And I remember I called my best friend also, and I told her what was going on, and she said, "You are going to be okay," which sometimes is not the right thing to say, but I think in that moment, I really did need to hear it. My father came to the emergency room, and he was like nervous enough for everybody put together, so that was helpful. Like just ease the burden a little here. Who is this woman? Doctor? I don't know who she is. Do you know her? I said, "No, I met her 2 days ago, but she's going to operate on me now. So we're going with it, Dad. We're going with it." And that is what we did. They prepped me. And I remember they were like going to do another scan, and you came in and you're like, "Oh no, she's bleeding internally. We're going straight to the OR." Okay. So we prepped for surgery, and you could tell them what you saw.
Yeah, so the hospital was great. So I think it was about 15 minutes from the time I met you in the ER till we were in the OR. And so you did get your laparoscopy, and what we saw was that you did have an ectopic on your right side, and you did have a fair amount of blood inside. But the reason the ectopic didn't look the way it normally does on an ultrasound is most of the time the ectopic is in the middle of the tube or in the part of the tube near the uterus, and your ectopic was at the far end. Now, even though you had in vitro fertilization, so that as opposed to a natural conception that occurs in the tube, the conception occurred in the lab and they put the embryo inside your uterus, but it's not uncommon that it can get up into the tube and get stuck there. So I saw that you had an ectopic at the far end of your tube. I also saw that you had a fair amount of endometriosis behind your uterus, and your left ovary was covered with endometriosis. So because the ectopic was at the far end of the tube, I was able to remove it without cutting into your tube. So that minimized the damage to the tube. And also, I wasn't concerned about the healing of the tube, so I was able to go ahead and burn off the endometriosis at the same time. So it was a little bit of a blessing in disguise because you were one of the people that's unusual, but you did have what we call stage 3 endometriosis, that you did have enough endometriosis where the surgery was warranted, even though nothing had shown up on ultrasound. So thank God everything went very smoothly with the surgery. And by the time we got done, it was probably early evening. And I went into the family waiting area, and it was completely full. So I went over to your husband and your parents and let them know everything went well with the surgery, and I had taken pictures, and we could go into the conference room for some privacy, and I can show them what the pictures. And at that point, the entire waiting room stood up. That's when I met your whole family, and that everyone in that large waiting room was there for you. So that was pretty amazing. And every time I go through the waiting room, I still picture your family there. But so I got to meet the family, and but fortunately, everything went well.
Yeah, so I remember waking up. I remember it so clearly. I remember that you woke me up. You were standing over me. I remember saying, first words out of my mouth, do I have my tubes? First words. I wanted that opportunity to be able to get pregnant on my own one day. And you said yes. And you said, we found a lot of endometriosis. And I got rid of it. And I was like, I love it. I know we met 2 days ago, but I love you. I remember that so clearly. And of course, my family came, many of whom my siblings did not even know that I was trying to have at all. So this was a bit of a shock for a couple of people. I will say at this point, almost none of my friends knew what was going on. And then I remember them saying, you're going home now. And I was like, going home now? I almost died tonight. I'm staying here, staying in the hospital. I'm not going anywhere. They're like, oh, no, you're going home. They're not letting you stay here. So obviously I did go home. I don't know how they got me into that car. Driving home, did that just happen to me? Did that just happen to me? Did that just happen to me? Woke up in the morning. My mother was sitting at my bedside. I was like, what are you doing here? She's like, oh, are you kidding me? Couldn't sleep. If I was like hanging by a thread up until this point, I was completely drowning at this point. Anxiety and depression through the roof. Probably started by the 6-month mark of trying. So this was really putting it over the edge. And I think all of those emotions really just manifested themselves into a bad spiral. I would have flashbacks all the time. It was like Groundhog Day, except the worst day of your life, over and over and over again. I remember the anesthesiologist. His name was Dr. Hazan. I remember you telling me, Rachel, we're in good hands. Dr. Hazan is here. I could go through that day from minute 1 till the end in my brain, and it would take hours. I would have nightmares that were so bad that my husband had to wake me up from them because I would be screaming. And there's basically nothing else that I thought about at all for the months to follow. And I finally realized that I was not really okay and I needed to see a therapist. And thankfully I found somebody and he diagnosed me with post-traumatic stress disorder with obsessive thinking. And I took a lot of comfort in that diagnosis because, in a way, it was very validating to hear that I was not necessarily in control of all of those emotions, that it was almost physiological what was happening to me. And I got I felt a sense of control in a way because it was not in my control, if that makes sense. I was able, when the thoughts came in, to say, that's the PTSD, that's not me. I didn't really want to be happy at the time. I remember telling him that. I said, I don't want to be happy. That's fake. That's a lie. Happiness is a lie. And slowly but surely, I was able to remove myself from those chaotic thoughts. And you gave us the green light to try again. So we did, and we tried on our own. Nothing happened. Then we came back to you to do 2 more IUIs, and nothing happened. And we said, okay, we're going to go to IVF. We could technically do a 3rd IUI, but we said, after everything we've been through, we're going to start the IVF process. And you put me on a medicine called Lupron.
Yeah. So Lupron is, and you took the Lupron a week after ovulation, and what it did was cause your brain to release your natural FSH and LH, which are the hormones that stimulate your ovary. And after a week of releasing your own hormones, it then would suppress your brain from producing that, so that by the time you got your period, your brain would be suppressed and you could start stimulating your ovaries for IVF. But what we see sometimes is the surge of hormones augments implantation because it's right around the time that the embryo would be implanting. So, so you took the Lupron,
I
and
took the Lupron.
then you did not get your period.
I did not get my period. I think it was day like 30 or 31, maybe tops. And I was even staining a little bit. And I remember calling you, and we were figuring out next steps. And you're like, you didn't get your period yet? And I was like, no, but I'm staining a little. It's only day 30. And you're like, go buy a pregnancy test. And I was like, why? Why would I do that? This is probably the only month in the past 2 years that I cannot possibly be pregnant. And bought the pregnancy test. I called up Eddie, and I was on the phone with him, and I was screaming. I was like, Eddie, it's positive. It's positive. I am not lying to you. I am not lying. I swear it is. And he's like, but why? But how? But why? But how? And I said, I don't know, but there is a second line on this test. I called my mother. I was in her house, called her up, come quick. So, I don't know, I'm pregnant. And she was like, oh, it's pink. You're having a girl. I was like, she was wrong. But obviously it came to you, and you could tell why did I come to you? Because we wanted to make sure that it was not in my tubes again. People who have an ectopic have a tendency to have a second ectopic. And thankfully the sac was in my uterus. And that was Shia.
So that was Shia, and it was really, fortunately, you had an uncomplicated pregnancy and delivery, and it was really wonderful to be with your family again at Shia's Brit Milah. And you know, so a little bit over a year from when I met your family on such a traumatic day at Lenox Hill Hospital, we were at your shul celebrating Shia's Brit Milah.
Yeah, so that was very special.
And then, so to fast forward. So then you had Shia, and then came time for number 2. And
yeah, so number 2, I called you. I was like, am I doing this? I'm so scared. I'm going to start the whole process again. Um, and you said, don't worry. We got that endo out. Don't worry, Rachel. It's gone. And second month trying, took the test. I'm like, is this possible? Like, does this happen? Do people get pregnant so quickly? I cannot believe this is happening. Once again, double check, send the uterus, we get a Barbara. I was thinking actually that it's so apropos of them because like Shia got to drive you crazy and then come up with something awesome. And Barbara, people pleaser, I really like fitting into their roles nicely. About a year and a half after Barbara was born, I noticed that my periods were becoming very irregular and I was staining between periods. And I was like, okay, something's up. I've been through enough to know that this is a red flag. I went to my OBGYN and they performed a sonohystogram. Yes, am I saying it right?
Yes. Which
is the basic.
It's,
yeah, you tell me.
It's a little bit like the hysterosalpingogram, but what we do is put a little catheter into the uterus and put some sterile water, and we do an ultrasound, and if there's a polyp or a fibroid, a little growth inside the uterus, we can the fluid doesn't flow there and we can see it.
So they did find a 1 centimeter polyp on my uterus. So it was back to Lenox Hill OR for me. I called up Dr. Lobel, of course, and she said, I'm going to do this for you. Talk about PTSD. I was back in it. I think there's actually something called exposure therapy, which has you relive the most horrible moment of your life. I guess I did that in some strange way. But you were able to remove the polyp, and you said, start trying, call me after the holidays, and if you're still not pregnant, we'll talk. So I waited and tried. We launched the program in between. I remember standing up there. I'm like, I'm trying right now. Nobody knows. I'm still in the middle of it. I'm still in my childbearing years. And came back to you and said, nothing doing.
So, so basically then, and this is not uncommon, that every time you try is a little bit different. And so I wasn't concerned that the endometriosis had come back significantly because the surgery fortunately had gone well, and there wasn't much visible endometriosis left. And pregnancy is a really good treatment for endometriosis because endometriosis is hormone dependent. And the variations in hormones that you have with the natural cycle can stimulate the endometriosis. But when you're pregnant, you have 9 months of high estrogen and progesterone levels, and that can suppress endometriosis. So this time I thought we were back. We were really in the unexplained category. So I suggested we go back to do the medication and the insemination. And so we did a cycle. A year ago, tomorrow will be the first anniversary of the cycle. And this time, fortunately, it was successful. And
my first IUI that worked. My first one.
So, well, if at first you don't succeed, try again. So,
I did not, again, have a lot of confidence in it. Not that I don't have a lot of confidence in you, but IUIs sometimes get a bad reputation. But thankfully and surprisingly, it worked. And I had my daughter Linda 3 months ago. Cutie. Don't know what she is yet. Didn't figure out the role yet. But obviously extremely, extremely thankful to you for, of course, not only saving me that day, November 20th, 2013, but also helping me conceive all of my children and possibly, maybe God willing, in the future. I have no idea what's going to happen. My story's not over yet. This is, like I said, still in the childbearing years. But so thankful that I have these three miracles.
Well, I think it's important to remember that everything is from Hashem, but I'm not
100%.
opposed to him making me look good. So,
Best shaliach.
so Rachel, what pushed you to start and get involved with the program in SBH?
So obviously going through everything that I went through to get pregnant with Shaya, I was completely alone, isolated. Um, I was looking up on Wikipedia the other day, and the word ectopic means out of place, and I thought that was so perfect. That's what I felt. I felt out of place. It's not like there's somebody you could just call and say, "Oh, talk to me about your ectopic pregnancy and how it went and how you felt after." That does not have that like that. That's nowhere. I didn't know what doctor to go to. I had no support for from my peers because I didn't tell them anything. My husband, who I believe is a saint, preferred that we keep it private. He told me I could throw him under the bus, so I am. Um, I do wish that I was more open about my journey at the time because it was isolating as it is, but the shame, it's like there's just an added layer of shame when you are constantly almost telling secrets. I actually remember that one of my friends came over, surprise visit, one day after the surgery, and I just sat on the couch and didn't move. Like, that's to the extent that people did not know what was happening. And I was pushed to start this program, thankfully, by two volunteers who felt like SBH must be addressing this problem. And I agreed with them. I knew at the time that there was these organizations out there that helped people going through something, but I had no idea what the difference was between them. I did not understand what they offered. I didn't even know what I would ask. And I made it my mission and SBH's mission to create a program that I personally would feel confident and comfortable calling. SBH is the place you turn to for help. We should be able to help this huge population of people who are out there completely alone and don't know where to start. And we said, let's start something that is the first phone call. You're not sure which doctor to go to? First phone call. You need help? We're going to connect you. You want to talk to someone who had an ectopic pregnancy? We'll connect you. There is nothing that we can't help you with. And most importantly, we can hold your hand through this maze of a process. It is so difficult to go through alone, and having just one person who gets it, all the difference. For me, that was you. I spoke to maybe one or two other people who came to your practice. They spoke to me probably for 5 minutes. Those 5 minutes were so helpful. The doctor pointing to his wife and saying, "Those are my two kids." So helpful. Imagine we could create a program around this. Imagine we could provide services to help you every step of the way. It's been beyond our wildest dreams. I mean, my expectations were very low, though, so I don't know. But this is, I mean, over 150 couples that we've helped so far in less than a year and a half. Maybe you could speak to, feedback from your patients.
Well, I think it's fantastic what you're doing, and I really want to thank you. And also, it's you and everyone involved, and the privilege that I've had of working with the community and how people reach out and help one another. And someday I'd like to write a book of all the wonderful experiences I've had with the community. And now you're formalizing it, and it's really fantastic. And that a friend of mine who's a rabbi taught me that when we pray for someone to have a complete recovery, We pray for Refuat HaNefesh and then Refuat HaGuf. Because if you heal the soul, then you will heal the body. So I appreciate everything that you're doing for really healing the soul, and also to, to guide people. And fortunately in New York, there's lots of good choices for doctors, for people trying to get pregnant once they're pregnant. And but I think that to have some guidance and to speak to someone who's walked in your shoes is invaluable.
Yeah, I think our peer-to-peer program is second to none. I mean, to be able to talk to somebody who totally gets it, who's from your community, who's gone through something similar, who's gonna take care of you. I mean, that's what it's about. And we actually have a tagline, I don't know if you know this, called Together We. And I always find it to be so fitting, because that's what this community is about. We're gonna help everybody together. We're gonna get through this together. I was talking to a client recently who told me that she feels so alone, and I told her, you are never going to be alone. You can feel that your story is singular. I absolutely think everybody's story is singular. I wouldn't say that mine is the craziest or the least crazy. I think we have to, respect everybody's journey. They're all unique, and you should reach out for help as soon as you feel that you need it. Actually, probably the hardest part is picking up the phone and realizing I could probably use some help here. Reach out to me, the SBH line, my co-chairs, Gladys Hazan and Michelle Sasson. Robertson Molly Heber has been so instrumental. Alison Esses, who just had a baby, yay. We have the best volunteers, the best committee. We're very, very lucky. And just to go back to what I was saying before, like at the 6-month mark, I was Diano. Like, you don't have to have a ruptured ectopic to need help. And if you're going through something even more difficult, traumatic, again, we're definitely here for that. It's been a privilege, and I think we could only grow from here. There's so much more to do and so many more people to help. I think probably my strongest moment was picking up the phone and calling my therapist that I didn't have. I didn't have my therapist, because if I had one, I didn't. I remember actually calling you and saying, Dr. Lobel, what do you think? Like, is this a good, like, should I go to a therapist? And you were like, yeah, I think that would be good. So thank you for encouraging me to do that. And thank you for everyone who's supported this endeavor up until this point. And thank you to everyone who's planning on taking the next step and reaching out for help. I am so in awe of you. Someone called me a few weeks ago and I told her, you picked up the phone and asked for help. You are already in a better place. And she saw it immediately. Like, she was like, you're right. I'm going to be okay because I called somebody. If I don't know what time it is, but do we have time for a few questions possibly? 8:59. Okay. Probably 1 minute left.
Questions I have here.
It's not telling me that I'm almost done, but let me just see what we got. Okay. Does endometriosis come back after surgery? I think that we did discuss that. You said it can?
It can, but most times it does if it's not too extensive, and particularly if someone gets pregnant afterwards, most of the time it can come back.
Somebody asked, is it true that that birth control can suppress endometriosis?
Yes, if it's taken in a non-cyclic fashion. So that that if it's taken continuously, not so that you get periods, it can suppress it.
So just to explain why I didn't go on birth control, I have a clotting factor, just to like throw an extra wrench in. So I was unable to go on birth control, which would have definitely helped with the pain, at least, even not knowing if it was endo or not. But I was unable to do that. So I just had to ride the pain wave for whatever, many years.
Did you notice a difference in periods after the surgery before you got?
Absolutely. Absolutely. Within 1 month, I mean, within 1 month, I remember the period coming and saying, I am okay. I don't need Advil right now. And that was huge, huge. So now I don't have that pain. I haven't rolled on the floor in a while, thank God. Oh, is there any cure for endometriosis?
Well, I mean, I would say you're pretty much cured from endometriosis. So, usually surgery takes care of it, and particularly surgery followed by pregnancy. So, there are some people that it comes back, but most people after treatment don't have a recurrence.
And is it genetic?
We don't really know what it does tend to run in families. So, if I see a patient and I know her sisters had endometriosis, I'm more likely to operate on her, and usually we'll find it.
Okay. Oh, are ectopic pregnancy is genetic?
No.
Okay.
If you have twins, could one be
Oh,
ectopic?
twins. Could one be ectopic and one in the uterus? Does that exist?
Yes, that happened when I did IVF on a friend of mine. So, rare. But like in your case, only one embryo was put back. So it would, I'm not aware that an embryo has split and one gone in the tube and one in the uterus. And nowadays we tend to one embryo, but if you put back more than one, or even with a natural conception, you can get what's called a heterotopic pregnancy, one in the uterus and one in the tube. And if it's recognized, you can take the one out of the tube, and there is an increased chance of miscarriage with one in the uterus, but but oftentimes the uterus can do okay.
Any other questions?
One of the major differences between
Oh, someone asked about the difference between PCOS and endo. I'm not sure that they're connected at all.
Yeah, they're completely different.
Yeah.
And endometriosis involves the lining of the uterus. PCOS involves the hormones regulation of the ovaries.
Anything else you want to say before we go
Well,
from here?
I can't thank you enough for sharing your story, but also that your story has now become part of so many other people's stories. And that I think it's important for people when they're going through such the hard time to remember that most people will get there, and also that to try to look at the bigger picture. And so, that other people have come to me because of you, that you've helped people, and now with the organization. And while in general, I think people should be very sensitive when talking to other people, that a couple of years ago, a patient came to my office, and I asked her how she was referred, and she said she was on the beach in Miami, and these two Syrian women asked her if they had kids, and she said they were trying, and they suggested that they come see me, and she wasn't having too much luck at her other place. So she ended up having a beautiful set of twins. And if someone's watching and referred this patient, thank you very much.
Wait, I do have a question. When do you think it would be appropriate to seek a second opinion?
So I think second opinions are underused, and your situation was a little bit unusual, but treatment, there's the science and there's the art and there's luck. And so someone can be having excellent treatment and not getting pregnant, and someone can have not so much treatment and get pregnant. And that, if someone in your circumstance, you don't feel comfortable with the program, which doesn't mean it's not a good program, but it may not be the right program for you. Or, if a doctor says, particularly if it's something, to use a surrogate or donor egg or something big like that, to get a second opinion. But, if things aren't working or if you're not comfortable, to get a second opinion. And sometimes people come to me and I encourage them to go back. I think everything is fine with their care. And other times, we can suggest something different. But people shouldn't hesitate to go for a second opinion.
Somebody's asking, but we may have probably covered it. When is the right time to see a fertility specialist? Is it, did I do the right thing waiting the full year?
Yes. That, and, sometimes because of the statistics that if you're under 35, we say wait a year. If you're over 35, 6 months. But in your situation, if 6 months, nothing's happening, to go to your OBGYN for basic evaluation is very reasonable to do. If it turns out, that there was a significant problem with the sperm, your husband could see a urologist, or, if you had a polyp in your uterus, to address that. So, it's really more people's comfort level. Or if someone has irregular periods, then that's something that you should just go right away.
Okay. I think we're wrapping up, so I just want to say thank you again. And let's do this again. It was fun.
Okay, well, after your next 3 kids, we'll do this again.
Funny.
All right, great. Well, thank you so much. And it's especially meaningful to do this since tomorrow's our 1-year anniversary of creating Linda. And but also in last week's Parsha, we read how Hashem remembered Rachel and opened up her womb. And I think you're a good example of that you had so much trouble getting pregnant with Shia, and then got pregnant right away with Barbara. So I think it's important for people to remember, when that first pregnancy is so difficult to achieve, that oftentimes it becomes much easier after that.
Yeah. Thank you for that. Appreciate it. And we're going to save the live. Don't worry, everybody. Thank you all for coming. And good night.